This is our huge atrium here in the main part of the hospital. It's got all these cool hot air balloons. It's got our front desk up here and our main elevators. It's got this performance area that's really cool. People come perform here, different bands or artists. And then we have our Seacrest Studios here, which is our own little sort of private radio station that we use to broadcast to the kids in the hospital. Sometimes famous people come and they'll get on the broadcast and they'll take questions and talk to different kids and do different things. So it's a really cool place to have available for the kids and for us too, when people who are interesting or famous or just great musicians come by to perform at Children's National. And don't miss our Walgreens that we have situated right here in the hospital for patients. And we also have this coffee bar over here so that as soon as you come in the morning, it's easy to grab it and go. This is the hallway on the way from the main part of the hospital to the West Wing. The West Wing is where our offices are, the resident offices are, and it's where you start your mornings, getting there, signing out, and pre-rounding. Some people call this hallway the gallery because of all the artwork on the walls. We have different exhibits here from time to time, and they range from local artists to the exhibits that are coming through the area that are more well known, to patient artwork. And it's really cool and it's really calming, and it's fun to come in from month to month and see what new exhibit is going to be up and what new kind of artwork there will be. But it's always a great place to walk through and sort of get in the right mindset, get in the zone, get ready for a day at work. We're entering into the main neurology office right now. Right now it's a little bit empty, but usually this is where all of our MAs and administrative assistants, telehealth nurses, all hang out and do their work. That's Mariana in the back, Janice in the front, Dr. Packer's office in the back, and our little kitchen here with our little fridge. Is there anybody in the room here right now? All right, let's find out. If times are different, like the old days, you'd be able to come here and sit in this room and wait for your interview on interview day. This is typically where we all gather, get to know each other, learn a little bit more about the program. And it's also the place where we do a lot of our educational sessions throughout the year. It is where we have our lunchtime sessions, it's where we have our morning sessions. And again, if you guys were here, we'd all be sitting around talking about what our favorite karaoke song is as we do some icebreakers and learn about the child neurology program here at Children's. So every morning as you come into work, ready to see some kids, you're gonna come into this room, which is the resident's office. And you can see that it even has a big window. That's right, sunlight all throughout the year. And you really do become family in this room. So many great memories get made here, so many funny inside jokes that happen. And it's really a great place to call home, at least during your fourth year. And then we'll see where the fifth years spend their time. All right, let's see the seniors' office. These are the chiefs. Let's see what they're up to. Okay, we have Dr. Eric Strong and Dr. Jenny Harmon. Let's see how they're doing. Guys, Eric, tell us about this room.
This room is our happy place. Where we come to decompress and be happy and discuss the amazing cases we have here together.
Jenny, anything to add?
No, that's pretty much it. It's our room to be ourselves and to enjoy each other's company. But Eric's right, we really do talk about a lot of neurology in here and share cases and bounce ideas off of each other. And we like that too.
Have you spent any nights sleeping in here?
Yes.
Not what I was expecting. Okay, this makes for a good interview.
Have I ever slept for 15 minutes on the floor at the end of a night shift because I didn't want to walk to our very nice and comfortable call room where I was worried that I wasn't going to wake up for sign out? Yes, I have done that.
There you go.
This is a meeting of the minds, and this happens pretty regularly at Children's. What you'll see is, this is Dr. DiSabella, program director, Dr. Grotman, world-renowned neurometabolic expert. She actually led our SIG yesterday for neurogenetics. And this is Kuntal, a board-certified geneticist and one of our fourth-year fellows. You guys, are you solving all the problems of the world?
Trying.
We're making more.
All right, well, we're banking on you guys, so work hard.
Okay.
We're talking about creating a curriculum for neurogenetics and other things in child neurology.
You see, always innovating here. One thing that we care about, innovation. Another thing we care about, education. And the third thing we care about is our patients. One funny thing about this hospital is that as you cross from here over to the other side, it goes from floor number 4 to floor number 5. I don't know about the planning there. All right, we're coming this way onto 5 East. This is the neuroscience floor. So 5 East is the neuroscience floor. This is where we have all our inpatients. Say hi to our desk clerk. Rounds are probably going on right now. We'll see if we can find them. All of our patient rooms over here. Over here, these are all neurology patients. Most of these rooms are hooked up for EEG, but a few of them are hardwired for our surgical patients who have grids placed so that we can do localization in preparation for epilepsy surgery. All right, so we're sneaking in on rounds here. This is patient-centered rounds where we have both the medical residents, our senior resident, and then we have our fellow, our attending, and our nurse practitioner, Anne, who's wonderful. We also have our charge nurse, the nurse for the particular room and patient, and then we also have our pharmacist and our nutritionist come on rounds with us to give their opinion and their input as well. Rounds are basically fellow-driven, so Dr. Strong does most of the talking for the family and also giving the plans. And then Dr. Toshin, who's our attending, is there to back him up and give her opinion as well. It's a big unit here. Here's an example of one of our lovely rooms. You can see pretty spacious, nice views out of the window. And every room comes with either a chair or a sofa that folds out into a bed for parents. And parents are encouraged to stay with their kids, and typically it's one or more can stay with their kids, but now during COVID, sometimes a little bit different. We got TVs in every room, and if you look, you'll see that kids can have video games brought into the room. They can have all kinds of fun stuff brought in. We have Child Life here, who brings in mats for little kids and coloring books and all different kinds of art, finger paints, things for kids to do while they're here, since, you know, it's not the most fun thing to be in the hospital, especially when you're a kid. All right, let's take a look at the EEG room here. This is where we do all of our EEG reading. Who's here? Dr. Yoon is here. She's one of our fellows. Say hi, Dr. Yoon.
Hi.
These are the applicants.
Oh, hi, guys.
I mean, not really, but, you know, on a video.
Oh, you're
But see how enthusiastic she was? Because she thought you guys were really on here? That's children's for you. And really encourage you to come in here, read your own EEGs, see what you can find, and try to interpret them for yourselves before you ask your fellow, Dr. Yoon, what the real read is. All right, now we're going into the PICU workroom. Let's see if we have any fellows in there who can tell you a little bit about what it's like to be in the PICU. Oh, we have Kuntal, one of my favorite fellows. Say hi, Kuntal.
Hi.
Kuntal, can you tell the applicants a little bit about the PICU and what the experience is like rotating here?
Sure. So neurocritical care and stroke, it's one of our essential inpatient services. It's one of our favorite rotations. Reasons being we get to round with the pediatrics ICU team and we give in our recommendations as consultants. We see critically ill children with status epilepticus, stroke, brain bleed, trauma, and all sorts of zebras with hyperammonemia, metabolic disorders. This is our workroom. We work with our attending and our nurse practitioners. We really learn a whole lot when we are on this rotation.
Awesome. Thank you so much, Kuntal. One really neat thing about children's is that every Christmas, the First Lady comes and reads books to the kids in the hospital. Sometimes she goes to patient rooms and sometimes she'll go to other parts of the hospital, but she always goes down to the atrium where lots and lots of kids come down and gather around, usually with the dogs from the White House too. And the First Lady reads them a book or a story and even answers questions sometimes. And on the 3rd floor, we have our healing garden, which is sponsored by the First Ladies of the United States. It's for 2 things. One is for the patients who are feeling cooped up inside and just want to come outside and have a chance to get some fresh air, be in a nice green space, where they don't feel cooped up inside. You can see that it's pretty beautiful to be out here. The other thing is, for the people who work here, sometimes this is a great place to come and relax and not have to think about things for a while, or to just think over what's been going on in your day or your life. Sometimes taking a break can be really useful. Having beautiful views of the city definitely helps. You can see this nice panorama that we get from out here while we sit and just think about things. One of the great things about a children's hospital, especially our hospital, is that we love to decorate and dress up and do fun things, especially when holidays are coming. And since Halloween's just around the corner, you can see that we've built a little bit of a Harry Potter world here. And we're working on it to make sure that it's ready in time for Halloween. Here on the third floor is our Pediatric Clinical Research Center. Now this is a dedicated space for research where we have rooms, whether it's for infusions or just patient rooms, to have people come in here as we do different trials, whether it's a drug trial or whether it's just one of our IRBs that we've had approved with some sort of a study protocol being done. This is a place that's reserved only for those patients and with specialized nurses who are trained in all of the different protocols that are necessary here at Children's. Here on the second floor, we have the Bear Institute, our innovation center, which you can see is really beautiful, great for team meetings. Lots of learning and innovation happening there. We also have our physician's lounge. Take a peek in here for you. No one's in here right now, but this is our physician's lounge. Free coffee, and things are typically little snacks in the fridge and in some of the drawers. And you can see we have Operation, obviously, and Monopoly, but nice little area to come and hang out when you have a little bit of free time or just sit and eat some lunch. Great little place to stay. And this is our lunchroom. All over here, our cafeteria. This is my favorite place to go to eat lunch. It's got my favorite sandwiches, the best place to get yourself a Reuben or a wrap. Say hi. We're saying hello to the applicants who can't come here to view the hospital, but need a tour anyway. So this is their fake tour. But I figured I'd show them my favorite sandwich makers. Felt like this is something they need to know exists. Thanks, y'all.
Have a good day.
You too. We have a hot station over there. We have a grill. You'll see there's a pizza station. Back there is our seasonal station where you can get sort of one menu item of the day, whether it's a taco salad or wings or something else that's a little more unique. We have our salad bar that's pretty popular as well, and then some prepackaged food and drinks over there. And everything comes as part of your deal as a resident here. They give you extra money that can cover all the costs of your food. All right, passing by the Family Resource Center. Let's duck in here real quick, take a look around. And this is Allie. Allie, can you tell us a little bit about the Family Resource Center?
Sure. So this is actually a fairly new space. It opened in August of 2019, and we redesigned it to make it super family and kid friendly. We have a ton of books that we're currently gifting to patients because of COVID-19 regulations. But yeah, families can come and spend time in here when we aren't under COVID restrictions. We do a lot of fun programming, story times, all the things like that. We have our pet therapy dogs up in here for story tales, helping encourage kids to learn how to read. And it's a great place for kids to find their new favorite book character. So we love it here.
Awesome. Thank you, Allie.
Thank you, Jeff.
Most of the radiology department is located. You can see it's underwater themed, which is kind of cool. We have pediatric anesthesiologists that help to sedate our kids who are here. And you'll notice here that for the kids who are a little bit nervous, there's this little module in the wall that they can stand in, and they feel like they're surrounded by whale sounds, which is really cool. It helps calm them down. It's a really cool feature that our child life people here have thought of to try to help kids tolerate procedures without sedation when possible. Around sometimes, as a team, we come down here to the neuroradiology department to see our neuroradiologists and go over imaging with them. Let's see if there's anyone here that we can say hi to. Dr. Vizina, my favorite neuroradiologist.
and welcome to Children's.
Thanks, Dr. Vizina. All right, so this is a place that you'll get to be really familiar with. This is our neurosciences clinic, where you'll have your resident clinic. You're in resident clinic a half a day a week during your 3rd and 4th years, and then during your 5th year, 2 half days per week with your continuity clinic, seeing your own patients and staff and attendants. This is our wonderful nursing staff. Say hello. Oh my gosh, no mask. We're gonna have to redo this. How incredible. We have our ophthalmology rooms over here, and actually our esteemed ophthalmologist, Dr. Stasheff, is here. Dr. Stasheff, can you say hi?
I can.
You'll be learning lots about neuro-ophthalmology from him. Thank you, Dr. Stasheff. See, you're coming towards Helen, one of our favorite nurses down here in the Neuroscience Center. Helen, say hi.
Hi.
And she is hard at work, as always. One of my favorites. Past Helen, you'll see the physical therapy area, a little bit of a gym, where kids come to get physical therapy and see PM&R. As long as there's no one in here, we can keep this. We're gonna check out the resident workroom where they spend a lot of their time and see who's in here today. It looks like we are having the MDA clinic, is that right?
That's right. Yeah. Welcome to MDA.
Awesome, this is Dr. Barucha Goebel. Dr. Barucha Goebel, do you wanna tell us a little bit about the MDA clinic?
Sure. So we have a long history of a multidisciplinary clinic here. So we take care of children who have neuromuscular conditions, and many of them require a number of services to help in terms of optimizing their health care. So we have a number of specialists as part of our team who help in their care, from pulmonary and rehab, our therapy groups, we have nutrition over here. We also have a genetic counselor who works with our team. Who else? Ortho, cardiology.
And we all know the team wouldn't function without.
And of course, the staple of our team. We have our clinical coordinators here,
And our research
Kathleen
coordinator.
and Maggie. So in order to take care of patients with complex medical needs, I think it takes a big team, and we have a lot of fun in working together to take care of these patients and their families.
Awesome.
Welcome.
Thank you so much for taking this time. Here's one of the rooms where our residents see patients during their continuity clinic. This one is Diego themed, and you can see it definitely caters to the kids. A nice little table for our residents to work at, and then an examination table here with ophthalmoscopes and otoscopes. All of them work. You can also see that our rooms are set up for telemedicine visits as well. Ever since the pandemic started, we've been incorporating telemedicine visits, whether it's from little work spots at home or if you want to come in and see patients there. But now we're doing a mix of both in-person and telemedicine visits. So it's nice to have rooms that are set up for both the in-person visits and to have the telemedicine capabilities built right in.